How do you work as well in terms of when you have clients who are neurodivergent, when you've done an assessment with them? How do you then sort of come up with like a care plan, so to speak, and how do you sort of like, explain the diagnosis, things like that? How does that work for you?
I mean, I always work in an evidence-based way. I work using evidence-based practice, and what that really means is looking at the research evidence. What do the nice guidelines say? What does the research evidence say would be effective for this certain problem? But I also use my clinical expertise, which is drawing on the many clients that I've had the privilege of working with and thinking about, okay, well, what works in practice? When you take the research evidence and blend it with your clinical expertise, you're able to formulate a really a treatment plan which you think might work with the client. But ultimately, the most important thing is the client's choice. So when you think about the research evidence and you think about what you think would work, you want to be putting it to the client and saying, this is what I think would be helpful. What do you think? And they might say, yeah, that's a really good idea. I think a really good place to start or to illustrate this is with trauma therapy. So there's two nationally recommended treatments, EMDR and CBT, trauma-focused CBT. They both involve different techniques, and actually when you describe them to the client, they would be able to tell you what they think would be most helpful. So I think working in an evidence-based way, in a really collaborative way, and I'm very goal-directed. So when a client says to me, this is what I want to change, I want to stand up in a lecture theatre and not be worried about my face turning bright red and me choking on my words, I would say, okay, well, that's great. Let's make that happen. Where do you think we will be in 6 weeks' time? And each session really working hard towards that.